rescue remedy?
Yeah.
So rescue remedy is a homeopathic drug. So it's like taking an herbal, but you're taking the essence of the herbs. So what they do is they take a container and they put the herb in it, and then they dilute it 10 times, and then they dilute it 10 times. And I think they do like hundreds of times. They keep diluting it down to where there's nothing left of the plant in that water. So it's the energy of the plant left in the water. So it's almost like mind medicine. You know, it's kind of like a mind medicine type of thing. It's like a placebo, some people feel like, but the arnica, the tea relief, is homeopathic, and it works.
Yeah.
You know, I see all of those homeopathics for pets, and they say it's placebo, and they work. So the energy's in there somehow. So actually tonight I was going to talk a little bit about like different medicines, like the stages of medicine and what you give, because I've had a few clients, it's constant actually, but this week just in general, as I was thinking about this talk, where like a pet has allergies, or a pet has arthritis, or a pet has some condition, and you go to the veterinarian and they diagnose it, and then they give you a medication for it. So you're already starting at this extreme level. So they're either giving you a medication and then surgery or a procedure, where you have all this room before that, if it's like not an emergency, to work within this area before going to this one, or you can start with this one and kind of work your way back. And as long as it's not an emergency, I always like to start first, like you get a diagnosis or a situation, like your pet starts vomiting. So the first thing you're going to see, how bad is the vomiting? You know, how serious is this? Are they at a point where they need to be rushed to the hospital, or are they eating okay? They're acting okay. They can go on their walks. They don't seem painful and hunched over. They're not vomiting blood. So you're kind of assessing the situation. And if it seems like just like a normal, they vomited once or twice, then you can start thinking, okay, what caused that? Did I feed them a certain food? Did they pick something up on their walk? Is it a cat that got a diet that didn't agree with them? You know, for cats, there was a study that they did, and they were testing for something. I forget what they were actually testing for in the study, but they were giving these cats one single diet, the same diet, consistently through the study, because they wanted to test something in the poop, I think, or some kind of enzyme at the end. And they found that this one diet that they were feeding them, thinking that would be a consistent thing, it was different in the same food, different batches. The company was getting different sources of protein in, putting different ingredients in it, even though the label kept saying the same thing. Little parts of the food were changing. It wasn't a consistent food, so they had to abandon the study because it wasn't consistent enough. So, you know, something like that can trigger a cat or a dog, just some kind of ingredient that you would never even know. So once you gather all your information, try to figure out, okay, this isn't an emergency, or even if you're given like a really bad diagnosis, like your pet has cancer, you don't have to react right that minute and start giving a steroid right away. You know, you still have, you can ask the doctor, what's reasonable? How many days or hours do I have to think about this? Can I wait 3 days or 5 days and gather some information and come back and we can talk about it? So there's usually time involved. And then after that, kind of gathering your information, talking to friends, talking to other people, getting, you know, your veterinarian's opinion if you went to them, and then asking like a chiropractor or a physical therapist or an acupuncturist or someone who does something different than what that doctor does. Because if you keep asking the doctors, they're all trained in the same way, and you're going to get a very similar answer. So you want to try to get as much information from all these different places of people with similar things. Sometimes I'll just go on Amazon and Google a condition and come up with products and just start reading people's comments of what worked and what didn't, just to get ideas of what's out there and what kinds of things people are using and what works and what doesn't. And then you can move on to using something like a homeopathic that's pretty safe in most cases. If you're using the right homeopathic, you'll see a difference probably right away. If it's something like arthritis, let's say, for example, and you start using tea relief, which is a combination of homeopathics, then you'll see a difference pretty quickly. Like you saw a difference in your dog pretty quickly.
Yeah.
Yeah, so you'll see it immediately. And if they react poorly to it, usually they'll just have a little GI upset and they'll throw it up, and then you'll say, well, maybe that's not for them.
Right.
Right? You could also do things like if it's arthritis or even if it's a GI upset, you can do laser therapy, or you can do pulsed magnetic electrotherapy. You could do all these different therapies without resorting to medications. You could do topical arnica. You could do topical herbal things. That would be good. So you have all of this room to play with without having them ingest something. If it's something where you want to move on to herbals, you can research herbals and kind of move on to that and use a whole plant herbal instead of a supplement that just has like the one part of the herbal in it. Or most supplements have a dried herbal in a capsule form, and that's usually the worst way to use an herbal because the dried plant sometimes concentrates some of the medicine in the plant. Where if you're using a whole plant, you get the water soluble things, and then you also get the dried plant, not the dried plant things, but you usually get a more varied part of the plant that works all together. So it's usually better to use the whole plant if you can in certain ways. You can use a tincture of a plant, which will bring out more of the medicinal qualities of it. You can use a plant in apple cider vinegar, which is kind of brings out more of the minerals of the plant. You can cook a plant down, something like dandelion. If you cook it down, you start breaking the cells down, so you're getting a little bit more of the vitamins out of it. So usually the supplements, when they're in a capsule, that would be the thing I would go to last, unless it's something like Marshmallow or Slippery Elm, because those things, you actually want the powdered part of the root. You're using a root or a bark, and you're getting the bark and the root, or a mushroom. So those powdered things, if you're getting the pure powdered part of that plant, that's actually the plant. So that's using the whole medicine for that plant. So you could use, some kind of herbal. That would be your next step. And then from there, probably like a supplement, which is like the capsule form of a plant, before going to a medication. Once you start getting into using a medication, like a pharmaceutical, you're taking a specific compound of a medicine and you're targeting it towards one condition, which can be really helpful. But also, once you take that one part of it, there's usually a side effect. So, every medication has a side effect, has several side effects to it, because you're not using a whole plant and it's not using a whole varied approach. You're taking that one thing. And that one thing usually, sometimes they'll have medications that you use for one condition, like Serenia was a medication that they use all the time now. It's prescribed for almost every condition for pets that I see. And it was originally prescribed for pets with motion sickness. So it was almost like Dramamine, but it was in a pharmaceutical prescription form. And it's a different medicine. But so Serenia was originally intended for a one-time use for motion sickness. You didn't use it every day as a medicine. And what they were finding is that it was curing GI upset in pets. So then they started expanding and using it off-label for things like kidney disease. And because chronic kidney disease also usually has a symptom of chronic vomiting, where a pet is nauseous all the time from the toxins that are not being processed from the kidneys. So Serenia they started using it off-label, where you'd give it 4 days on and then 4 days off, because it's also acts on the brain. So it also is a calming agent. That's why it's used for motion sickness. It kind of calms the brain center, but then it also calms the trigger for vomiting. So then they use it for vomiting for chronic illnesses. But you'd have to take the pet off it for 4 days because they didn't want them to get addicted to it. And then they started realizing if you're using it for a chronic kidney failure case, that animal's lifespan could be, depending on how you're treating them, weeks to maybe a year or two. So they were thinking, well, if they get addicted to it, who cares? It's controlling their illness. So then now the recommendation is you can give it every day. And now they're also recommending it for pets that have not regurgitation, but pets that cough a lot. So there's a coughing reflex involved in regurgitation, and this medication also calms down the coughing reflex. So if you have a dog with like a collapsing trachea or some kind of regurgitation, it's causing them to cough all night. Like usually older dogs with their trachea that's maybe not working so great, and they're coughing a lot. So they're using it for that. So that's an example of a medication that has all these side effects and also all these other uses. It's kind of not really, it's got a lot of different uses. So medications can be interesting because you can put your pet on a medication and then they might have either it'll fix other things that were minor problems, or it'll make another condition even worse. So you have to worry about long-term use of drugs. Also because they have to be processed by the liver and the kidneys. So you can sometimes cause issues with liver and kidneys in animals when you use things like non-steroidals. You probably see that with humans too. You see problems with liver issues when people are on non-steroidals for a long time. So, that's getting into a type of medicine that it's hard to reverse. Once you put your pet on certain medicines, it's really hard to take them off, or people are very scared to take them off. I had a client this week who their dog, I've been seeing them for laser therapy, which works great for their old arthritic dog. But it wasn't quite enough, and they couldn't afford to have it done as often as it needed to. And they started using like linden tea and some herbals that I was recommending, but they just weren't sold on it completely. And they just finally were like, they were on the fence about using medication. And they finally just said, I'm going to try non-steroidal and just see what happens. So they tried the non-steroidal and it helped a little bit. The dog was able to get up the stairs a little bit easier. It's made the dog a little bit more comfortable. But they have to check the blood values for the liver every 6 months now. And then the vet that they saw, we also were trying quercetin because the dog has really bad allergies. And the dog was put on Apoquel, which is a medication that really targets the liver and it can be really, really bad for the liver. So they shouldn't be on that long term. So they were using Apoquel and then this new non-steroidal, and they were just scared that this dog's liver was going to start to go into liver failure. So they wanted to cut back on the allergy medicine. So we're trying quercetin, which is a natural anti-inflammatory. And the vet said, and then the dog's poop turned really dark. So the owner was kind of like, the poop changed color. I said, well, are they eating okay? Do they seem like they have GI upset? And she's like, no, it's fine. They're still eating okay. I'm like, all right, so does it look like blood? Are there any other signs? It's like, no, it doesn't look like blood, but dark poop can be a sign of undigested blood. So you start worrying, do they have an ulcer from something? Well, the first thing I would look to is the non-steroidal. It's known for causing GI ulcers. So instead, the vet said, well, it's the quercetin. Why don't you try to take them off the quercetin? The quercetin was the only thing helping the allergies. So instead of looking to the drug that has been proven to cause GI ulcers, they just said, well, there's an herbal that I don't know much about, so why don't you just stop that? So the owner stopped the quercetin. I started researching, and the quercetin capsules are usually paired with bromelain. And bromelain is from pineapple. And bromelain causes increased bile production in the liver, which can change the color of the poop because you're changing the bile production, you're changing the digestion. So the poop changes color. No ulcer, no nothing, but she's scared because the vet told her not to do it. So I turned to her, I said, you know what? You're doing linden tea every day. The main thing in linden is quercetin. You're giving your pet quercetin every single day. So let's just up the tea. Let's just double it and we'll be fine with it. That's my solution to that. But it's like interesting how scared people get. And I understand that if you're not comfortable or familiar, you don't want to cause more problems. But it's interesting too how, this vet that I know, she's very open to everything. She has no problem. And I know her. She could have called me and said, we're going to take her off the quercetin. And I could have explained all this to her, but they're not educated. That's not in their education. It's not what they were taught. And they don't have time to go back to school to learn herbals. It takes a lot of research and time. And they can be sued if they, recommend the wrong thing. So they just would rather say, take them off it and let's see what happens.
Yeah.
But then after medication, what usually comes is a procedure. So surgery, well, before that even, like diagnostics. So certain diagnostics are pretty harmless, but you have to put your pet through them and they cost a lot of money. But, sometimes you need diagnostics to see what's going on and to help you make decisions. So things like ultrasounds are pretty minimal. The only thing with an ultrasound is they've shown that ultrasound can be really harmful to babies. So once you're an adult, it's not really harmful to your body, but to babies that have not been born yet. So when they do all these ultrasounds on pregnant women, it's supposed to be really bad for the babies. So if you have a pregnant animal, I would say maybe hold off on ultrasounds of the belly area. But otherwise, that's a pretty benign procedure. It's not invasive. It gives you a lot of information on what's going on. From there, sometimes they like to aspirate something, which is sticking a needle into some part of the body, like a tumor or a part somewhere, or taking urine from the bladder with a needle. And that can be okay if you're trying to get information, but also realize once you start poking at some of these things, they get angry. The cells get angry and they react. And maybe angry is the wrong word, but they react. And sometimes they start multiplying because they think they're being attacked. And they might, a tumor might start growing larger after you start putting a needle in it. Or if your pet has chronic bladder issues and they take a bladder urine sample with a needle, with a cysto, by putting a needle in the bladder and taking a sample, if there's cancer in that bladder and they touch it with the needle, there are studies that show that you can aggravate that cancer and make it grow even quicker. So that's why doing a blind cysto on the bladder with a needle is not usually the best thing anymore. They used to just do it blindly. As a technician, I used to do them all the time without an ultrasound. But now they use an ultrasound guided urine sample, which is really the best way to do it, just in case there is something going on in that bladder that you don't want to disturb. So those kinds of things, x-rays, are not that bad. MRIs are those, MRIs and CT scans have very high radiation. So you should really think twice about when you put your pet through one of those. They need to be under anesthesia. So that's one insult to the body. And, the anesthesia today is the drugs usually go through the system pretty quickly. But if you have an older pet, their brain, I've seen cats and older dogs come out of them and never be the same again. It's not common, but it happens. And then the high radiation level. So these are small animals getting a high dose of radiation. Sometimes they'll use a dye study for certain things. The dye can be highly reactive in the body. So you just want to think twice. If you put your pet through a test like that, you want to first know that you are going to follow up with whatever that is. It's not just for your curiosity or for your vet's curiosity. It has to be for a reason. Like if your pet has a slip disc and you decide that you want to do surgery, so that information is going to be needed for the surgeon to actually go in and do the surgery. But if you're like, I'm never doing surgery on my pet, then you don't need to go ahead and do something like that, because the radiation is high level. And then from there you go into things like surgery. So that's the most invasive type of thing that you can probably put your pet through. And sometimes it's life-saving and you just go ahead and do it. Sometimes it's maybe not as necessary. Maybe you could have done some of these other stages first before doing like an exploratory surgery just to find nothing. And, we used to say in the hospital when a pet would go to surgery, because you'd see something suspicious on the x-ray, and it didn't really have to go that night, but the emergency doctor would get nervous and say, we really should go in just in case. And you call the emergency team in and they do the surgery and there's nothing. And we would never say it was nothing. We would always say, well, at least we confirmed it was nothing, so we can move on from this, which is pretty extreme for like a $5,000 hospital bill to find nothing that way for something that really wasn't an emergency. So I guess the basic point of all this is just that there are a lot of options before doing all the invasive stuff. And if you are going to do invasive, just think about it first. And you can always back off a little bit. And you could always have a conversation with your doctor and say, I'd like to gather some more information first. I'd like to think about that. Is this the reasonable thing to do? Because you want to work with them. You want to be them to be on the same team as you. You don't want to push them off and make them feel like they're not doing a good job, because they want to help. But you also don't want to be pushed into something that you're not ready for, or that your pet's not ready for. So just always feel like you have the right to speak up for your pet, and also ask your pet, what do you think? Sit and watch your pet and ask them and sit with them for a while and try to get the vibe of what they're telling you, because they will tell you. They will tell you if they want surgery. They will tell you if they want relief from something. They will tell you if they want to take a medication or not. They will tell you if they want a massage or laser or acupuncture or CBD or anything. They'll tell you. So listen to your pet and listen to your own instincts, and, you know, gather as much information as you can. I just see too often people just go in blindly, and they just, you know, all of a sudden they're calling me and saying, I went to the vet and they put them on steroids and they did this, this, and this. I'm like, well, why are you calling me? You did all this stuff. And it's hard to go back, you know, it's hard to, and I'm not there to convince people that they should be doing one thing or another, but there are steps. So I think actually during this whole COVID thing, people are learning to be more self-sufficient and to not panic as much when a situation comes up, because you can't easily go to the doctor and you can't easily get things. So people are realizing when they have to wait a day or two that, wow, maybe that wasn't an emergency when my dog vomited once. Maybe I didn't need to rush them to the vet and put them on Flagyl, which is a really kind of potent medication that every vet recommends. I can tell you, when someone calls me and says, my pet was vomiting and I went to the vet, I know that they will be put on Flagyl, which is metronidazole, which is actually banned in some countries. So it's surprising to me that that's just the first thing that the vets throw out there. And it's as an antibiotic, it's a very strong antibiotic, but it's also antiparasitic. So they're just trying to cover all bases by doing this, which is a little bit of lazy medicine. You could do a fecal sample and see if they have parasites. You can wait a day or two and maybe change their diet a little bit, let their stomach settle down, but they kind of always want to give you something to fix that. And especially since our pets don't use a toilet, if they have diarrhea, you know, people want to fix that problem right away. That's something you don't really want to have to be dealing with for that long. So the Flagyl is kind of like a godsend, and it's like, I'm just going to clear this up right now. But if you wait a little bit, there's things like Slippery Elm you can give them. You can give Marshmallow. You can do applesauce. I mean, there's a lot of little things that you can just kind of let their stomach rest and just give them bone broth for a day or two and just let their stomach calm down. So there are options. And I think with this whole COVID virus shutdown, we're all learning how to be a little bit more self-sufficient, which is nice to see. Does anyone do you have a question, anyone?
Numerous times you have mentioned in past lectures and in a lecture that I heard from, I guess it was I don't know if she was a homeopathic vet or I'm not sure, but anyway, the Slippery Elm and the Marshmallow constantly are coming up. So do you use those in combination with each other, and what's the best reason why you're using those two?
Yeah, that's a good question. So when you look up if you look up herbal, so homeopathic is more like that. You see some of the same kinds of remedies, but those are like the those little pellets.
Yes.
Yeah. So that would be like homeopathic medicine. And then the herbal would be like the whole plant, or like the supplemental kind of plants.
Mm-hmm.
Slippery elm I've used for a long time. That was one of the first herbs I started incorporating in, because I was seeing a lot of cats with renal failure and they were refusing to take medications. They just wouldn't have it. The vets are trying to change their diets, and cats are so finicky, you know, like they won't just change a diet. Some cats will, but they won't just change a diet overnight. And when they're feeling sick, they won't change their diet. So I was seeing these cats that were vomiting. They didn't want to eat anything. They were miserable all the time. So I started incorporating Slippery Elm because they were having, the reason why I chose Slippery Elm is because they were building up toxins in their stomach because their kidneys weren't functioning. So there was this toxin sludge in their stomach and they were trying to get it out. So the Slippery Elm, what it does is it's astringent and it tightens things up. So it'll tighten up the stomach and it'll keep those toxins from kind of getting back into the system, but it just tightens things up and makes them feel better. It's slippery, so it kind of lets things pass through their system also. And it also just calms down their whole system. So it helps with, a lot of cats get constipated when they have renal failure also. So it helps them to have regular digestion. And the taste of it is not that bad. So what I would have people do is make a slurry of it by taking one capsule. And this is on the PetWise thing too. I have a whole video, I think, with it and instructions. But they take a capsule and they put it in just like 2 tablespoons of hot water. Let it sit for 10 minutes because then it gets kind of like this mucilage kind of stuff. And then you add some cold water to it to make like maybe 1/4 cup or 1/2 cup. And then you mix that up and you can let that sit in the fridge for like a week. You could use that. And you could use it twice a day if they're very nauseous. And just give them like 1 ml and just kind of squirt it in their mouth, and they usually tolerated it really well, and that would do it. That would usually do it for these cats, where they would just regulate and feel better. You could also take the slippery elm. I feel like that was the most direct way, because these cats were not eating their food. So if you sprinkle a capsule in their food, they just weren't eating their food, and then they were never getting it. So this, at least you knew they were getting it by squirting it in. You could take a capsule and just squirt it on, and just open it up on their food also, and just put a little pinch on their food, and they would also get it that way. So the mucilage is good for either vomiting because of the tightening of it, or it's good for diarrhea because it regulates. It also like kind of tightens things up, and it firms up the intestines, and it helps with diarrhea. So if you had I think of it like if you had a flu where there's vomiting and diarrhea, slippery elm would be the one I'd go for. The marshmallow root is more of a mucilage. And that is, and also the slippery elm can help just tighten things if you have like a trachea that's not quite working, like elderly pets that are vomiting for that. Soothing for like coughing and hoarseness, and for ulcers. Marshmallow root is similar properties. I find it's a little milder because it's a root, where the slippery elm is from the inner bark of a tree. So it has tannins in it, Tannins. Tannins can be a little rough on some pets' gastric system, where it makes them feel a little bit nauseous. So it could be a little bit rough for some animals. Marshmallow I think of as a little softer. It's not a marshmallow, but I think of that. Let's see. Oh, sorry, they're sending me a message. Okay. So the marshmallow is it's a little bit more for, I would say, constipation. I use that more for, to kind of soften things up. It can also settle the stomach down. It doesn't really help with the vomiting part. So I don't use that for vomiting. I use it more for, and also I kind of look at the animal and say, you know what, this animal has a little bit more acute and extreme symptoms. I'm going to use slippery elm. And for an animal that has something a little bit more chronic and drying, I'll use the marshmallow. So if it's like an older pet with arthritis, and they're kind of constipated or have struggling pooping, or they can't posture because they have arthritis to poop, I'll use the marshmallow for that. I think it's also a preference. I think if you look online at certain herbals, they put both of them in, and they'll put plantain in, and they'll put papaya in. They'll put like a bunch of all different things that will target all different parts of the GI, and hope that one of them works. So a lot of those herbal formulas, it's like all of them at once. I don't know if that helps at all. It's a little, you could also try it, but if there's any vomiting involved, slippery elm. If there's any constipation involved, I'd go to the marshmallow first. If there's both, I would use slippery elm. Well, no, sorry. If there's diarrhea, I would use slippery elm. It's a little, but they're similar. They're similar.
Okay.
I always have slippery elm on hand. It's one of the herbs that I like to use. I guess I kind of have an affinity for it because it's from a tree, and I'm kind of like a tree person. And the marshmallow, I just kind of started getting into maybe a year ago. So it's kind of a little bit of a newer herb for me to use because I was having such good success with the slippery elm. But yeah.
Well, I'm going to try to give that chestnut bud a try.
I'm curious. Yeah.
For bandit. So
how are you going to give that?
Well, so I'm ordering I guess it's a tincture.
Yeah.
In dropper.
Yeah. Probably water, yeah.
He's, there's just no way that I'd be able to rub anything on his gums. I mean, there's just no.
You wouldn't.
Yeah. I like all 5 fingers. So
yeah.
What I would probably do is put it just a little bit on a little bit of food, and he would gobble that right up.
Okay. Yep.
So I'm going to try that, I think.
Okay. You can also, I don't know with the homeopathic if it works the same way for something like that, but sometimes you can put it on their ear and it gets transdermally absorbed. I don't know if that's one of the things, like slippery elm and marshmallow, you can't, because you need it really inside the GI tract. I don't
Right.
know for something like that. CBD, sometimes you can put it on the ear and it works because they have receptors all over their body. It may work, it may not work. It would have to be a test for him, but yeah.
Hmm.
Sometimes I hate to say it, you can give things rectally also. Some
Yeah.
cats like really don't mind that, and they're like, they won't let you put something in their mouth, but you can stick it up in their bum. I don't know. Dogs.
Well, I don't know what she's doing, but he seems calmer right now. I mean,
Okay.
I don't know if you heard him, but he's been going nutso,
Oh,
whining and crying because of this thunder uh,
wow.
storm going on. And so, Emily's taking one for the team and taking care of him right now.
So how long does the medicine usually take to kick in?
It's amazing. I give him a trazodone about probably 12 hours before a grooming appointment at night, and then I'll give him one again in the morning about 2 hours before the grooming appointment. And the one time I took him to the groomer, and she had said something to me, and I was like, I sedated him, and she's like, "You did?" And I'm like, "Yeah."
Wow.
Certain
Wow.
triggers that this boy is it it's so deep in him that he lived through this crap for 6 years, getting smacked around by a bad groomer every 6 weeks.
Oh my God.
So I mean, he's really, really come far way. But this thunder really bothers him quite a bit.
Have you ever, I don't know if we talked about gabapentin.
I have that.
Yeah.
The vet recommended that, and I
Yeah.
gave it to him. Oh, he was just, he kept tripping up the steps.
Oh, how much did you give him? Do you remember?
Just a tablet, just a
Was it a
tiny,
50
tiny tab.
milligram?
Uh, I can tell you, I
Yeah, I'd
have.
be curious to know.
Yeah, I mean, the trazodone we started with a half a tablet, and then the vet's like, "We'll give him the full tablet." So I did that, and like I said, I give it to him twice. Here it is. Here it is. Here it is. Here it is. Let me see here. I got all his medicines in one. There it
Oh,
is.
oh, yeah. So you could try it again with the lower dose with him and see, but it takes away their inhibition also. So it calms in a anti-anxiety way. Like it really, at least in cats, you see where it makes them where they're not flat out and they're not zoned out and they're just kind of calm, but they can still walk around and react. So it takes away like that just fear.
Okay.
So it might be something to play around with. It's up to you. You can see what's best for him, but
We'll see.
he
I
looked
was
pretty
hoping.
calm just now.
What's that?
He looked pretty calm just now.
So Bandit, where are you?
Oh, there he goes.
That's because we were kind of cornering him in the kitchen.